जिनको नहीं चाहिए वो अपना क्रॉस करा लें।
Hello everyone, welcome back to yet another to our Sunday weekly meet. This is the DMA IMA NDB meet number 86, and this is our 86th consecutive meeting on all things COVID. So we have been discussing COVID protocols, and the and Dr. Nidhi has been very efficiently discussing COVID updates around the world on this platform. So today we are going to be discussing the early treatment protocols. And without much delay, I would request Dr. Nidhi to please take over the session and enlighten us a little further. Over to you, Dr. Nidhi.
So good morning, everybody. I think it's time to revise whatever we have done. Today's session we will keep very crisp according to what we should do at what point of time. So let's start with the update. If you look at what is happening around the world, there is the August peak that everybody had in August 2020, which was the wild type or the Wuhan peak, in which the deaths and the cases were kind of both going up. Alpha was higher than the Wuhan type, and the deaths and the cases were both going up. Delta was again higher than the alpha peak. The deaths and the cases were both going up. But if you look at Omicron, the cases are going up, the deaths are going down. The only exception to this rule is perhaps US, because, and we'll come to that at a little later stage, perhaps because of some population factors. This is the WHO graph of what has happened through the pandemic week by week. And Americas, as well as Southeast Asia, largely India, seem to be driving the global numbers. But you see again, with every previous peak, the deaths have gone up, but with the present one, the deaths are going down. Is this because of the Omicron variant, or is it because inherently now the virus is beginning to be recognized by the body? Remember that the death is not due to the virus. The death is due to the hyperinflammatory response and the thrombogenic response in the body. And that is due to the cytokines. So if we look at Omicron, UK as of 10th of January had about 96% Omicron coverage, Canada about 90%, US about 88%, and yet, in fact, their CDC director only yesterday said that probably the deaths in US are still due to the Delta variant. India, we are saying 81%, but I think that's a clinical estimate because we're not doing that much sequencing as yet. Italy and Germany, 69 and 28%. And so Delta still seems to be present in a lot of geographies. If you look at how the Delta has gone up, stayed the dominant strain, and started coming down. So as of 10th of January, Delta is gradually being replaced in Germany, but UK, Canada, US, India, they're all showing less than 20% Delta. This slide, I've actually magnified the tail end of the graph. If you look at Israel, which has given 4 doses, not an additional booster, but 2 additional boosters, you see the graph is only going up. You see US, the graph is, US is this dark red maroon line. The graph kind of seems to be plateauing out, but too soon to tell. UK seems to be past the peak. Japan and India are just going to shoot up. Look at this, they're just ready to take off. Israel, from this graph you can't see, but from here you can see that there seems to be a little bit of plateauing, but not certain. US again, a little bit of plateauing, but not certain. UK has come down. Given the fact that UK and South Africa have both taken about a month plus to start showing the downtrend, we should be expecting the same in India. Around the end of January should be where we should see this bump coming in India. If you look at South Africa, as of 14th of January, they're showing 5,235 cases, which is less than the 7-day average of 5,461, but only barely so. And the peak seems to be over. The population, keep in mind, of South Africa is 60 million. And I'm going to just tell you why this is important. UK, the population is about 67 million, and the new cases as of January is nearly 100,000. And we saw 5,000 in South Africa. So with comparable populations, you see what has happened in UK. As I've been telling you, that this is probably because UK has an older population profile. They have some comorbidities and the population behaviors are different. This is despite vaccination of about 90% in UK, and at the time of Omicron hitting, about 25% in South Africa. So vaccination doesn't seem to have any effect on this. US population of 333 million. They have hit nearly 1 million cases on 14th of January. And they still seem to be focusing on what India is going to do. Population of Israel, just 10 million. It's a sixth of the population of South Africa or UK. But the number of cases are 5 times that of South Africa. So proportionately, despite 4 vaccinations, the number of cases counts are too high. But Israeli population is also quite fit, and we haven't seen hospitalizations or deaths going up here. Going by the sequences, these estimates, I don't know whether to believe this or to believe this, but well, that's what the reports are. In India, 82% Omicron, in US 88%, in Israel 90%, in Canada 91%, in Denmark 92%, in UK 96%, and in Japan 97%. Japan has so far performed very well in the pandemic. In Delhi, in the first week of January, these are the official reports, that there was still about 28% Delta, 65% Omicron, and 7% others. This was almost the reverse in the last week of December. Some countries, notably Spain, want to move from testing to identify and say कि अब तो ये endemic है, जो करना है कर लो, इसने तो वही करना है जो ये करेगा. But even their own scientists think, and this is quoting verbatim, Lopez Achuna, who is a leading epidemiologist of Spain, who's opposing this move, he says it's a mistake to think that the problem will no longer exist by not counting infections, or even by reducing the number of days of isolation, or by establishing quarantines in schools with 5 children instead of maintaining what was initially done. The problem continues to be there and it has to be addressed. Now, why this is important? Countries are looking at economies, countries are looking at getting people back to work, but assuming that the infectivity of Omicron drops at the 7th day, they are not asking for testing out of quarantine, and also they are shortening quarantines to 5 days because agar ho bhi jayega to mild disease hai. As I said last time, whether it is alpha, beta, delta, or Omicron, it continues to be COVID. When we treat our patients, we treat as doctors individual patients, and medicine has to be individualized. Public health measures can be that you have to come out of quarantine at 5 days, but as a doctor, you can make the assessment whether this patient needs another 5 days, 3 days, or 15 days. And that, as a doctor, is your right to take that call. So our COVID tracker is up again, and I was very happy to see that. But our COVID tracker, as of 15th of January, midday, reported additional 2,53,411 cases in the previous 24 hours. It showed the number of cases kind of flattening out, recoveries increasing, deaths definitely going down. Now, why I'm saying this? Because John Hopkins tracker says something very different. It says a number twice as much as this. And so it says that India recorded 5,33,000 cases as of 14th of January.
I think they've not recorded one of the, if you just see 12th Jan or 13th Jan, they have reported 0 there. So I think they've compounded that, and they have, so I think that's what the double figure is from.
Yeah. So, but I think the COVID India tracker is in sync with the government of India figures. And so I don't know whether to believe this or to believe that, because ye to double hai.
Yeah. No, but then if you just see, like, 1 or 2 days before, there is one day when they have said
Where is zero?
So they can have just probably that. And this has happened, I think, 2-3 times in the last week.
Yeah.
So, yeah.
Now, these are from the Hindustan Times and from the Times of India. And this is what I was getting to, when we talk about numbers, when we talk about infections, and when we when we say that we should move to the endemic phase, क्योंकि ये तो mild disease है, the positivity is rising in Delhi. Apparently, positivity is falling in Mumbai. But is this real? Or is it because testing has decreased? And we are having various authorities tell us that, testing criteria have changed and you should. And at the same time, we say that 80%, 60% cases of Omicron are asymptomatic. तो अगर आप उनको टेस्ट नहीं करेंगे तो ये सर्कुलेट कर रहे हैं, और अगर ये सर्कुलेट कर रहे हैं तो बाकियों को इन्फेक्ट करेंगे. फिर भी 60 to 80% एसिम्प्टोमेटिक रहेंगे नए इन्फेक्शंस में, लेकिन by the sheer numbers there will be some who will need more care. It is true that only around 1% of active COVID cases are in ICUs in India right now, which is a good thing. And they are all saying that in Delhi, at least, we seem to be, coming into the sense of false complacency by doing fewer tests. If our test positivity is rising, that the time to increase testing is there, not to decrease it. This is directly from the Hindustan Times. They did a very good number crunching supplement yesterday, which was a tear away. The case fatality rate they wanted to show is not simply because the daily infections are right now low or not being recorded or whatever, but it is really low. And this is the case fatality of Delta. This is the real case fatality of Omicron. From 0.8 at the onset, 0.2. And as it showed here, a slight dip, and we don't know whether this will plateau out or it will rise. We don't know yet. So if you look at the cases, the light blue, this is the cases of Delta. And the light red are the deaths in Delta. A lag of around a fortnight, 15 days, but kind of parallel to the graph. If you look at Omicron, the cases and the deaths. So the cases are going up sharply. The deaths are kind of just not rising. Another way to look at it is what is the load on the hospitals right now. अभी सर कह रहे थे कि टायर्ड होने का टाइम नहीं है, but honestly, I think a lot of doctors are getting tired of stupid public behavior. People go for dips in the rivers, people go for election rallies, people behave irresponsibly, and we see spikes, and we also hear things ke, what is the way forward? So cases are rising sharply, but hospitalizations are not. Hospitalizations are in fact going down. Home isolation definitely is up, but also by the new guidelines, you have to come out early, so probably going down. Looking at our 4 cardinal states, Kerala performing so well. Every graph is going down. active cases going down, recoveries going down. That's because the new confirmed cases have gone down. Delhi, sort of bump in the curve. Maybe this is peak having been hit. Most likely, this is less number of testing. Active cases definitely down because Omicron has a shorter disease period. So even though the numbers are up, it depends on, when you say that this case is not active. Recovery is going up, deaths plateauing out. Maharashtra, nearly 45,000 confirmed. Again, a slight bump. Don't know whether a feature of decreased testing or of actual on-the-ground picture. Active cases going down, recoveries going up, deaths plateauing out. Uttar Pradesh, 16,000. Now, Uttar Pradesh, 16,000 looks like it is underreported. Reasons may be political, reasons may be election rallies, I don't know. But looks like it is underreported, as is Delhi's 24,000. Both seem to have some political overtones, and we'll not go too much into the depth of that, but both these data look a little unlikely. The government of India figures say that in the last 24 hours, we saw 264,202 cases as of 14th of January. The daily positivity rate is high at 16.6%. At 15th January, this has become 264 se 268. This growth, the rate of growth seems to have slowed down, which again, we have to see whether it is real or it is decreased testing. So active case trajectory, 14 lakhs. If you remember, हमने यहाँ पर track करना शुरू किया था, where it was less than 1 lakh. Now it is just climbing, active case trajectory. As of 15th of January, it is 14 lakhs. The daily positivity rate and the 7-day positivity approaching 12% and 15% respectively. But this is 14th January. If you look at 15th January, from 14% to nearly 17%, 3 percentage point jump in one day. The new guidelines, who has to seek immediate attention, who has to self-monitor, what you have to do. If you have unresolved high-grade fever, more than 100 for 3 days, if you have difficulty in breathing, if your saturation dips below 93% on room air on 3 readings within 1 hour. Now, why this is important is because it is cold weather, fingers tend to be cold, vasoconstriction hoti hai, kuch nail paint hota hai. So the right way to take oxygen reading is to sit down quietly, take a few deep breaths, warm your hands, remove all nail paint and color, and then take the reading. Persistent pain or pressure in the chest, mental confusion, severe fatigue or myalgia. Now, if you see, all these are what we were seeing were needed in Delta hospitalizations. This is not what we are expecting for Omicron. Also, this is a study which has been released, certified by ICMR and by the Ministry of Health. So the third dose of Covaxin holds promise by reassuring immunogenicity of a booster dose administered 6 months after completion of 2-dose primary vaccination. 6 months, not 9. Good neutralizing antibody titers are detected against homologous and heterologous SARS-CoV-2 variants following the booster. Reactogenicity in both vaccine and placebo arm was minimal and comparable. No serious side effects reported. As I told you last week, there is a study from Hyderabad which says that heterologous boosting, and it doesn't matter which were your first 2 doses. If you had Covishield, go for Covaxin. If you had Covaxin, go for Covishield. That's the scientific way to do it. Gives you 4 times the immunogenic response than taking a homologous booster. But there might be supply chain issues in that, and hence the guidelines are to take what you took earlier. But that is perhaps not the best in the present circumstances. Coming to treatment protocols, we all know this chart by now. What are the things that happen at what point of time? And even though we are not seeing ARDS or pneumonia very often in Omicron, we are seeing some patients with rising D dimers. We are seeing definitely CRP rising. And I would say that whenever you're looking at what you should be doing for an individual patient, treat the symptoms and follow the signs. Fever, take your pick. Whether you want to give paracetamol, mefenamic acid, or nimesulide. Cold-like symptoms, you take your antihistamine of choice, whether it is cetirizine, fexofenadine, or loratadine. For blocked nose, decongest with steam, saline, or with Nazivion or Otrivin. For dry, scratchy throat, give warm fluids and lozenges. For dry cough, you give cough suppressants. For productive cough, you give expectorants with or without bronchodilators and mucoregulators. If the temperature is rising, despite adequate treatment beyond 3 days, see the counts. What is happening to the neutrophils? What is happening to the neutrophil lymphocyte ratio? And start a higher antibiotic. We have been following either comoxiclav or cefuroxime, depending on personal choice, but take the pick that you want. Don't delay that. In a rising CRP, despite adequate treatment on 2 successive tests on alternate days, add colchicine once to twice a day or steroids, again, up to you. Breathing difficulty, look for lung involvement and treat accordingly. Falling oxygen, please make sure this is real before pressing panic buttons. Warm the hands, remove the nail paint, apply the finger oximeter and sit still and steady, and then do the readings. Rising CRP, despite colchicine or steroids, non-responding fever, anxiety, something doesn't feel right, do get the D dimers tested. These are the patients who need to go to the hospital. Identify high-risk patients and follow them super closely. Age more than 60, comorbidities like diabetes, hypertension, liver disease, kidney disease, but I'm going to flag obesity. Identify high-risk exposures, medical or paramedical professionals in close care settings, frontline workers in close care settings, exposure of more than 20 minutes unprotected or partly protected. unvaccinated or partly vaccinated individuals. So what is the role of near oral antivirals? The government guidelines also have left it to physicians' discretion. They have to be started in the viral replicative phase, if at all, in the first 3 to 5 days. And if within the first 5 days, symptoms are not improving or worsening, they have to be stopped and the patient moved to the hospital. What is the role of monoclonal antibodies? The previous monoclonal antibody cocktails have stopped working. The sotrovimab now from GSK has been approved for Omicron, but we are still seeing what it's really going to do. Baricitinib, a Janus kinase inhibitor, for its anti-IL-6 effect, has been recently approved, I think yesterday or day before, by WHO. It is a rheumatoid arthritis treatment, but I'm seeing very different, and I think Meenakshi will be able to highlight this better. They are saying that in India, a generic baricitinib is available at 400 rupees for a 14-day course. But what I'm seeing on the web is that it costs 22,000, 24,000, 27,000 for a 14-day course. So I don't know which one is correct.
No, I don't think it's 22, but yes, I think for a 14-day course, it was something around 18, maybe the prices have increased now, but it was around 18 or something, 18,000 when, in the Delta wave, it was around that. So it's quite expensive.
But to add to precautions with baricitinib, when used in rheumatoid arthritis, we were saying that it is not to be given if you have an active infection, and now you're giving it for infection. It was said that you will not give it if your immune status is compromised. That is, if you're having repeated or serious previous infections. Now we are giving it in COVID, which messes with the immune system. If shingles is there, if disease of the lungs, liver, or kidneys is there, if there are heart problems, high blood pressure, high cholesterol, or blood clots, or deep vein thrombosis, or pulmonary embolism, do not give baricitinib. If there is cancer, do not give baricitinib. If the white blood count or red blood count is low, do not give baricitinib. Now, with these precautions, which were earlier meant for baricitinib use, these are the patients who are at high risk in COVID. So use your discretion and see what works for you. The role of newer anticoagulants, low molecular weight heparin, low dose aspirin, as I said, D-dimer, and check. SSRIs and antiserotonergic agents, fluvoxamine and cyproheptadine. Cyproheptadine will start working immediately. Fluvoxamine takes about 10 to 14 days for its action to be visible. So in those 10 to 14 days, when you want antiserotonergic effect, you can start with cyproheptadine. Cyproheptadine also improves appetite, which with Omicron seems to be significantly affected, and is a very good anti-allergic agent. It causes drowsiness, so it will also improve anxiety. The support of preventive protocols stay the same. So vitamins B, C, D, zinc, steroids when needed, colchicine as needed, statins. So you will get what you look for. There are some studies which say statins have no benefit. Some studies that say that people who were on statins have significant improved outcomes. The newer anticoagulants, apixaban, rivaroxaban, and dabigatran, as needed. Ivermectin, I was very gently reminded yesterday that we have to stay within what are the government guidelines, but I'm going to stick my neck out and say that ivermectin should not be abandoned. At the end of the day, as I have been saying, vaccination is not the end game. You have to create a healthy population. You can see that in the figures playing out in the world. America, obesity rates are hitting 45, 50%. They are still grappling with rising numbers. South Africa, the population is young, apparently fit with less comorbidities, the numbers have fallen. If you look at what works in this context, it's going to be moderate activity, good quality sleep, and good diet. What does that mean? Moderate activity, which gives you a nitric oxide boost, done for as little as 4 minutes, is enough to boost your immune system. Being relaxed and in your recovery mode, rather than being supercharged and hyper excited in your adrenergic mode, is going to also promote and boost a good immune response, as well as give you the beauty sleep. Diet, as far as possible, we should be cutting out sugar from our diet. In fact, sugar is more addicting than cocaine. Anti-inflammatory diet, sir, काफी कहा करते थे, and Meenakshi had shared with us that anti-inflammatory lifestyle slide also. So, in short, move, meditate, eat to live, not live to eat, and use all means to boost a lifestyle of health and recovery. We have to start making the changes, and the changes need to matter. This is the only thing which will change the course of the pandemic going forward. Vaccinations are not going to do that. Till we are convinced that the numbers have truly started falling, or the disease is truly mild. And going by WHO definition, if a patient doesn't need to go to the hospital, the disease is mild. Ask the patients who are staying at home what their fatigue is like. They can't get up from bed. So clinically, going by those definitions, you can say that this is mild disease, but it's still COVID. Treat it like COVID. Any questions?
Apologies, I just stepped out for a minute. Yeah, so I don't think there are any questions in the chat box. Again, very good, a great presentation by Dr. Nidhi yet again. And not only the nationwide picture, but even the global picture is very beautifully represented in the PowerPoint that she created for us. So I must thank her for the great efforts that she's taking. So the house is now open for any questions or any comments or anything, maybe a new trend that we are seeing in COVID while we're treating COVID cases. If anyone wants to discuss that, we'd be happy to hear it out. I'm seeing a lot of my patients with high D dimer, like, the CRP also. We are seeing a strange picture which I have not seen before,
Yeah.
which is a high CRP on day 3, day 4, as high as 30, 40, and coming down with just colchicine and, no steroids needed,
Yeah. Yeah.
which is something that even in Delta I had not seen. And it just that has me thinking of what kind of effect would this have in the future. Will we see a greater number of patients with long COVID?
I'm also seeing a lot of monocytes. So I'm coughing, but I have tested negative 4 times.
So I'm seeing that.
You too.
So even that is something that I'm seeing. There are a lot of people, like in a cluster of positive cases within that, there are people who are just testing negative. They have all the symptoms continuously, so it's very easy for them to test nowadays with the rat being so easily available. So people are testing themselves and they are still testing negative. So it's a strange picture. Um,
So what do you think of the precautionary dose, except for the comorbids and high-risk people?
So there is a recent release, a press release from European Association of Medicines or Council of Medicines, which says that excessive boosting may actually harm the immune system. It makes sense. It makes sense because when we talk of boosting, we are not trusting the body to respond. Yes, the primary vaccination series could be 3 doses like it is in hepatitis B. But going forward, you've seen what Israel's 4 doses have done for it.
Madam, what is the guideline for the pediatric patient? We are seeing too many patients of the COVID in the pediatric case also.
I would say the same, that treat the symptoms and follow the signs. Pediatric patients are presenting with similar disease picture like any other viral illness. And I don't think we should be moving away from that basic clinical dictum.
I have a question. Please explain importance of antibodies, when to do and whether it is required, and how much is the level we should be satisfied with.
Antibodies are not the measurement of your immune response. They are offering only passive immunity. It is the memory T cells and the memory B cells which you have to allow to respond.
And
the reason,
so much you have explained about.
Yes, ma'am.
So much you explained about Omicron. So they are doing, it means government is doing the test, for Omicron and Delta separately. Genome sequencing they are doing and then reporting.
जो गवर्नमेंट ऑफ इंडिया की साइट में, let me just see, we are still showing, I think it was in the Ministry of Health only, they're still showing significant delta. I
selected cases only, they are not doing it all.
पर डॉक्टर अरोरा वो फिर भी ना वो दिखा वही रहा है, मतलब it's showing significant delta.
So one good thing with this current wave is that even having high CRP and nobody is getting serious. At least in my patients, none has got, say, low oxygen level or any seriousness. They are doing good.
Agreed.
CRP is going very high. In my daughter's case, it went to 140.
I treated a neighbor who's a young boy of 20, 25, whose CRP went to 140. He's a type 1 diabetic. So,
My daughter is not diabetic.
so I'm saying young boy,
Hmm.
but he was otherwise clinically responding well.
Yes.
So I just followed his counts. I followed his neutrophils and lymphocytes. I added colchicine, and within 48 hours, the CRP dropped to less than half.
Response was good. Yes.
And even in young group, are you giving this Ecosprin, and then for how long you are giving Ecosprin? Young group.
I am not giving any anticoagulation till I see reason to do so. But Dr. Preeti and Dr. Meenakshi might differ with me on that, because
Anticoagulation, we are not starting without the D-dimer being high, but
yes,
antiplatelets, we are giving earlier.
For how long?
21 days.
She's saying young people.
Young people, yeah, again, that's like everything depends on patient factors.
Yeah.
But of course, so if someone with a young patient with PCOD, I would still give them aspirin.
How long you will do? How long?
21 days, 3 weeks.
Okay. Thanks.
Dr. Nidhi, we are seeing many pediatric patients with gastric problems, vomiting, fever, and abdominal pain, and the whole family is COVID positive. So we are treating them symptomatically, of course, but presuming they are COVID positive.
Agreed. So what is the antibiotic that you're giving them?
No antibiotics, only
Okay.
probiotics for fever, paracetamol and Ondam. If the temperature is more than 102, just Meftal P SOS, if more than 102. And they are fine third day. Within 2 days, they improve with this.
So this is what is happening in this wave.
Yeah. So I'm also seeing a lot of patients with GI symptoms and more of upper GI symptoms. Is anyone else seeing that as well? I'm seeing a lot of nausea and vomiting as opposed to abdominal pain and diarrhea that we
Yeah.
were seeing in the earlier waves.
So I would say that I'm seeing more cough cold, maybe because I'm an ENT.
No. So cough cold is there, but if we just talk about GI symptoms, it's more of upper GI as
Yeah,
opposed to
yeah.
lower GI as
Yeah.
seen in the previous waves.
Yeah.
Yeah, symptoms are also there. Very common.
Yeah, nausea, vomiting, and fever, cough, cold to hai. These are the patient's presentation in government setup also.
Yeah.
And I think it is resolving much quicker. So जो आप
Much
कह रहे हो ना
quicker.
कि दो दिन में ठीक हो जाता है. On the outside, it is like 5 days is on the outside. And yet, you know, that thing of 3 days without symptoms, I think it should be the 8th day to come out of quarantine, not the 5th.
Also, one more thing I wanted to ask is everyone like, are you coming across patients who are unvaccinated and developing symptoms? Do we have any data on that front? Because most of my patients are usually vaccinated. So are we seeing any sort of severity in those patients? Is that something we can discuss on this forum?
I think up to it's not a pandemic of the unvaccinated. I think it is now. I think mostly people would be vaccinated.
No, I just wanted to know whether like they
Yeah,
are
yeah.
landing up with any severity or any, even if like they're going into that moderate disease. That's just something that I wanted to sort of analyze. But I think all of us here, our patients would most likely be
Yeah,
vaccinated.
yeah.
I don't think there are any anti-vaxxers here.
So I've come across one lady who's a diabetic, unvaccinated. She did not develop fever only for 1 day, mild fever. Thereafter, cough persisted. So this was a picture, but this resolved after 4 days. And of course, diabetes has to be controlled and other parameters have to be checked. She was reluctant in getting blood tests done. But these type of patients also, they are towards recovery path. This is what was my observation. Good morning to you all.
Good morning, sir. I think that may be because the previous waves have resulted in a degree of memory. And that is what I'm saying, that vaccination, though necessary, is not the end game.
Dr. Meenakshi,
Absolutely.
let me know, in COVID, you are prescribing 7 days rest, 7 to 10 days. And then if the patient has post-COVID complications, then how much rest you are advising?
In post-COVID complications, rest per se is not really required. You just need to sort of whatever your symptoms post-COVID, whatever symptom is persisting, you just need to tackle that. You don't really require a rest per se.
No, I read Dr. KK's notes, last notes. He said you can give a certificate for 3 months if there are post-COVID complications.
If there are post-COVID complications, ma'am, it's not that you have to give them rest. And if there are post-COVID complications, it will be the patient will actually find brain fog, headache, occasionally may not even want to get out of bed. So those things will necessitate rest anyways.
Or someone with, who's developing post-COVID bronchitis.
Spasmodic cough and breathlessness, I'm seeing in many patients for longer time.
It's because of clinical condition only. You have to give clinical condition, not because of
will be
COVID.
warranted by the clinical picture. So I think, it's not a generalized, it's not a blanket, number that we can give for every patient. I really think that would be, especially in today's time when not a lot of people are landing up with, in too much trouble. So, I think it just depends from patient to patient.
In Delta, you could have got away with giving this certificates.
Yeah. Yeah. So there were a lot of people who were actually developing post-COVID bronchitis, and there was fibrosis that a lot of patients were developing. They were, not able to finish their day-to-day activities. But now we're not seeing that because it's not infecting the lungs. It's not affecting the lungs. So yeah, Dr. Nidhi, you were saying something. I'm sorry, I cut you off.
No, that's okay. So I'm seeing a lot of monocytosis, which is kind of an indicator that these people might land up in long COVID. The profile of this long COVID might be a little different, like chronic fatigue syndrome, very difficult to treat and needing a lot of support. But also, I found that Government of India genotyping. If you see this magenta, all of it is Delta. And जो ओमिक्रॉन है ना, वो ये छोटा सा ये वाला जो ये बार है ना, ये ओमिक्रॉन है. And I don't know, because this is probably December and they've not updated the data. But this is what I was saying, that
Dr. Nidhi, that means Delta भी mild वाला हो रहा है.
पता कैसे चल रहा है सुनीता, डॉक्टर सुनीता की डेल्टा है?
नहीं, डॉक्टर निधि कह रहे हैं ना ज्यादा डेल्टा ही है, वो माइक्रोब तो थोड़ा सा है.
अब बढ़ रहा है.
It's taken over. I think last week or something we got data that Omicron has taken over Delta. But so there is this sort of rumor, but I don't know whether it's a rumor or it's a fact going around, that if you have Delta, then loss of smell, loss of taste is a symptom, but Omicron does not have the symptom. Do you really think that that holds true? I don't think so. I think that even Omicron, I don't believe. So. I don't think that we can go by that. Ki loss of smell, loss of taste hua hai, to ye Delta hai, because we are not seeing that Delta picture. We've seen enough number of patients of Delta to realize when you have a Delta patient.
Dr. Meenakshi, in my daughter's case, it was Delta only. You followed her very religiously.
So she does have a pneumonia, a documented pneumonia on HRCT, and lymphocytopenia tha. She had high CRP, high D-dimer, so it could have very well been Delta. But again, Dr. Kiran, and we really shouldn't be focusing on which variant it is. Just treat the symptoms and treat whatever you are seeing. So iske baare mein, this is just a media hype, I feel, I don't know how it works, but they are feeding the minds of doctors, they're feeding the minds of patients, and the politicians. So it's just something that we should.
Today is 5th day of her steroids. So
Yeah.
according to the CRP, you will advise her more steroids? Or
So
you will
usually
stop?
whenever we do prescribe steroids, we give a short course of steroids and we give the same dose for 10 days and we stop it without tapering it. So that is the usual protocol. And if the patient is like highly diabetic, then we might choose to sort of taper it off or stop it earlier. But usually we prefer to give it for 10 days, nahi to phir wo wapas rise ho jata hai. So wo suppress okay and then it again sort of comes up. So usually we like to give it for 10 days. That's the sort of protocol that we follow with steroids. Dr. Nidhi?
I would tend to agree. And I think very few people, I have not started steroids to anyone as of now. I haven't done that.
I saw her on video call and
Yeah.
she was
yeah.
heaving. She was heaving. She was gasping for breath while talking, was not able to finish maybe one sentence without gasping for breath. So we decided to start steroids for her.
And I think, the that line, that treat the symptoms and follow the signs, I think that should be our mantra. We should not be thinking that ye Delta hai, ya ye wild type hai, ya ye Omicron hai.
Absolutely. I am absolutely in concert with you on this. This is just something that I've been talking I have been doing the morning shows every single day and main yehi bol rahi hu ki whether it is Delta or Omicron, it should not come in between the patient and the doctor.
Yeah.
Absolutely agree with you.
Because it is still COVID. It's not until our population gets exposed enough and memory enough for the virus. It's still a novel virus, still capable of doing whatever it was doing in the previous waves. So treat the signs. वैसे भी कौन सी हमारे पास specific antiviral drug है इसके लिए? Signs ही तो treat कर रहे हैं हम.
Absolutely.
Last 15 years, I have not found any case or need to start steroid or anticoagulants.
So Dr. Kiran's daughter, along with one other patient, is where I have had to. So if the inflammation persists even in the second week, and the patient is coughing quite a bit, HRCT कराने के बाद में उसमें अच्छा खासा pneumonia दिख रहा है, then I think फिर इतना भी हमें नहीं सोचना चाहिए कि ये Omicron है and कुछ नहीं होगा, everyone is getting better. So इतना भी complacent I think नहीं होना चाहिए. So if we are seeing there is a clinical need, then we can go back to इतनी हमने steroids की बात करी है in the last wave, then we shouldn't be so shy also to start it if the clinical picture demands it, is what I think.
Regarding
how the SSR inhibitors should be continued.
Newspaper just you can say they need a news feedback for the story. That's all. That is why they create hype. Whether it is Omicron, this symptom, that symptom, they just take a one point and highlight, just create stories. That's all.
CRP 140 was very horrifying for me. I really got scared.
मैम वही है ना कि आपको मैंने बोला कि अगर 25-30 साल के लड़के को 140 जा सकता है,
तो वो तो आपने देख लिया ना, मैंने तो नहीं देखा. मैं तो डर गई.
नहीं मैम डरिए मत, मैम डरिए मत.
The patient is still, even when the CRP was 139, Dr. Kiran, the patient was still quite comfortable. Yes, she was heaving. She was sort of gasping for breath, but she was still able to finish all her chores. There was no hypoxia. So again, some people might debate that maybe steroids were not needed at that point, but the D-dimer was also quite high. And that inflammation begets thrombus, and thrombus begets inflammation. So that whole picture was setting in. That's when we started it. And hopefully it'll be okay. Let's see. Don't know, how right it was, but I think at that time.
I'll let you know the reports tomorrow.
Yeah.
Okay. Bye. Thank you.
Madam, how long the SRR inhibitor should be continued? Hello?
What's that?
SSR inhibitor.
SSRI.
SSRIs, I have not started, so I don't know when to discontinue. I prefer cyproheptadine because वैसे SSRIs के लिए they say that it is one of the safest antidepressants. And I have colleagues who use them. I'm not one of those. I prefer cyproheptadine because it has other advantages.
Which SSRI, if at all you have to use it, which?
Sertraline, Serlift.
Serlift.
Fluoxetine is also SSRI, very commonly used.
I know, but which one is being used?
Fluoxetine ke, sorry, was it fluvoxamine or was it fluoxetine?
Fluvoxamine.
Fluvoxamine had a good
Fluvoxamine, yes.
role in COVID. Yes.
Fluvoxamine is recognized SSRI, which is used normally.
So I don't think there are any more questions in the chat box, and very healthy discussions amongst
One question,
the group.
please.
Yes, please, Dr. Arora.
Anti-inflammatory diet for all of us.
Anti-inflammatory diet से सबसे पहले तो चीनी बिल्कुल खत्म कर दीजिए.
चाय बंद करो चाय.
नहीं, चाय is good.
Acidic है सर वो.
No. Phytoxanthines are very good.
चाय तो very good antioxidant है. Very good antioxidant.
Tea without sugar and milk.
What else?
Escitalopram is also SSRI. Escitalopram is also
All
SSRI.
boiled vegetables, they are anti-inflammatory.
मैदा, stop मैदा.
चीनी चावल मैदा.
चीनी चावल मैदा.
Yes, चावल and even wheat थोड़ा anti-inflammatory है.
Yes, Cyprus has also reported one more Delta Cron. That is
no, that is a fallacy. There is no
It is a
Delta
lab
Cron.
error.
Yeah, it's a lab error.
There was a contamination of 2 samples, and that's why they saw that. So that has been वो report हो गया है कि it was just a lab error. Yeah.
Dr. Meenakshi, how is Kolkata?
Kolkata is getting better. The numbers have decreased. Again, don't know whether it's a function of decreased testing, but so the positivity rate last week I had said was 44%. I think it's come down to around 28%. Not very sure of the number, but yes, it's come down. Yeah, almost. So every family we knew had more than 2 or 3 cases. And of course, that was at one point of time when you sort of over the time every family, everyone was infected. So yes, things are okay.
What
Looking
about
better.
the patients who are testing at home and not reporting? So we don't know.
So now Maharashtra has started that you have, if you purchase that COVID detection kit, you have to give your Aadhaar card. And also there are a lot of these COVID kits that have a QR code, and I don't know whether it will be, so then you have, that data actually gets updated with ICMR data.
That's only now they have started.
Yeah, so a lot of kits are having that now. Previously it was not done. And अभी महाराष्ट्र में ये शुरू हुआ है कि अगर आपने COVID kit खरीदी है तो आपको अपना आधार कार्ड देना पड़ेगा. So this is just something that came in yesterday. So
which is a good thing. Thing.
Yeah, it's a very good thing. Yeah.
You can test without QR code.
Yeah, you can. You can. Of course, you can.
You can.
But like the people who are responsible and educated probably would. So जितना कम हो रहा है, something is better than nothing is what I would say.
Yeah.
Thank you.
Yeah, so a great session, Dr. Nidhi, yet again. So no one can wind it up like you, the way you portray all the nations and give us an update at the end of the week. This is just our, exactly what we need at the end of the week. And so a big thank you to you for putting in all these efforts and doing this for us. As Dr. Nidhi rightly said, कि patient और doctor के बीच में नहीं आना चाहिए कि whether it's Delta or Omicron or whether any other variant that comes in, COVID is still COVID. And how Dr. KK used to say it, it's a manageable, inflammatory, thrombogenic viral infection. And हमें ये सब words को अपने management में हमें याद करना चाहिए, not forgetting his first word that was manageable. So on that note, I would like to end the show today. Thank you everyone for joining in. We'll be back next week with another show and more things COVID.
Thank you so much. Thank you.
Thank you.
Thank you. Thank you. Thank you.
Thank you.